I'd like to talk to you about another very common symptom that occurs in the population, and that is lower back pain. Now, majority, again, a lot of people in the country are often will struggle at some point, during their time with some sort of element of lower back pain. It can be short lasting, it can be long lasting, but certainly a very frustrating symptom. And it's something that is certainly very important to get checked out with your rheumatologist. Now, the commonest reason for people getting back pain is often the natural wear and tear of osteoarthritis. We're going to get some element of wear and tear going on in the lower back, in the lumbar spine area. We can sometimes have discs coming out. They're called disc herniations. Sometimes they can pinch a nerve and they can cause a bit of sciatica type pains, which I'm sure you've heard of. And this certainly is a very common reason for the lower back pain. We describe this as a general term. We call it mechanical back pain. And as I say, it's often due to natural degenerative changes. Now, you don't have to always have degenerative changes in the lumbar spine to have mechanical back pain. Lots of time we are getting physically deconditioned and we have weakness in our core area, in our muscles, tendons, ligaments around the lower back lumbar spine area. And these can just get strained and stressed, and that can result in a lot of chronic mechanical back pain. The key really in terms of treatment for this, obviously you need to get assessed and fully diagnosed. Once it's decided that this is more mechanical back pain, you certainly need very good physiotherapy. You need a back exercise program. You need to be doing the exercise strengthening of the lower back to really kind of strengthen up and prevent or reduce your chances of having flare-ups of this pain, and reducing the suffering of the pain or the intensity of the pain with the regular exercising. Now, another reason obviously to go to the rheumatologist is to rule out other possible causes of lower back pain. And the most important, or one of the most important conditions from my point of view, is to rule out the inflammatory condition called ankylosing spondylitis, which you may possibly have heard of. Now, this is an inflammatory autoimmune condition that can attack the spine, and it can cause a lot of stiffness in the lower back. It can cause a lot of pain. And this is something that happens a lot more in men than women, but certainly in women it can happen. Now, you must go and see the rheumatologist to get yourself fully assessed. And when you do go and see myself in one of my clinics, I look to take a full history. A full thorough examination will be performed, and then we will arrange some blood tests. We'll look at inflammation markers and a few other specialized tests. And then we'll also potentially, most likely, I will arrange an MRI scan, which will really look at everything in the lumbar spine area. We can look for the discs, we can look for anything hitting a nerve, and then we can look for any suggestion of any inflammation being present due to ankylosing spondylitis. Now, as I say, the most commonest cause will still be the mechanical issue, the natural wear and tear, or the natural muscle type deconditioning is the most common, but we must try and rule out the inflammatory condition, which is approached and treated in a different way in terms of anti-inflammatories, and we do use specialized medication to control the immune system as well. And there's no reason, once it is diagnosed, something like ankylosing spondylitis, there's no reason once we have treated you, you can certainly live a very good quality of life. I hope that is useful. That is certainly a very common symptom of lower back pain. Please come and get yourself checked out at any one of my clinics. I'll be more than happy to see you. Thank you very much.